It was around the second dose of fentanyl going into my IV bag that I stopped trying to control how much all of this was going to cost. I had been arguing with every decision the caregivers at the emergency room were making. Is this CAT scan actually necessary, or is there another diagnostic tool? Is there a cheaper version of this drug you're giving me? And reminding him repeatedly that I was uninsured, but either the opioids in my bloodstream, or the exhaustion of trying to rest in a room next to a woman who, given the sound she was making, was clearly transforming into a werewolf, forced me to surrender. I walked out of there 4 years ago alive, yes. And, as the doctors and nurses kept reminding me, if I had waited another 48 hours to discover I didn't actually have the magical ability to self-diagnose and self-treat serious problems with Google and Herbs, I might have gone septic. But all said and done, I was also walking home to a $12,000 bill, which was approximately half of my annual income as a single woman. It took me several years of hardship, contributions from my friends and the assistance of the hospital's charity program to pay off the $12,000. Then, last month, it started again. I was at home. I turned my head a little, the whole world started sliding away from me, and I crashed to the floor. I tried to crawl back into bed, insisting, it'll pass, it'll pass. My husband, on the other hand, was raised in a country with compulsory public health coverage, so his first instinct upon something weird happening isn't to lie down for 48 hours and see if it goes away. He immediately started plotting the route to a hospital on his phone. I was back, but this time I was married. The whole hospital visit cost us $30, including the prescription. Everything was covered by his insurance. That's when I realized I can never divorce my husband. The first emergency room visit might have been an anomaly, a freak health problem that the nurse explained as, sometimes these things happen. The intense vertigo was the result of the deterioration of the condition of my ears. It has been a problem since childhood, one left in, let's wait and see what happens, condition until a weird virus last year. Yes, I was the big idiot who caught a debilitating non-coronavirus virus during a coronavirus pandemic, forced me to a doctor, who discovered significant hearing loss and structural damage that will require lifelong treatment and intervention. As a freelance writer who has tried and failed for years now to get a real job with real benefits, the costs of the surgeries and hearing aids and other treatments the doctor sketched out as part of my future would be suffocating. But almost all of it is covered by my husband's insurance, making my health and ability to access healthcare dependent on his presence in my life. While I convalesced from the virus last year, I watched the discussion about health insurance take over the Democratic primary debates. All data is taken from the source, https://www.theguardian.com/article link, https://www.theguardian.com/commenters free/2021/dual/23/americans-healthcare-insurance-spouse. #health #West Palm Beach News #Fox 4 News Dallas #News #NY Times #CNN #News Now